To talk to you about a patient who came in that had IBS for over 40 years. And she was able to get better once we identified that she had a parasite called Blastocystis hominis, and we're able to help her get rid of that. So, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the FreeDiet. And I've had the opportunity to help. I've seen over 100,000 patient visits over the last 34 years. And one of the most common things that people come in are gut issues. And this particular woman came in with a lot of bloating, abdominal pain, indigestion, constipation. She said she had IBS for over 40 years, had been to many different doctors, was on different medications she had tried. The most recent one was 5 years on this antispasmodic medication. The thing was, even though she was on the medication, she still had symptoms. She even went to a functional medicine doctor before me, blood testing and a breath test, and put her on some supplements, but she still didn't know what was causing it and still had the issues. Besides the digestive issues, she was having fatigue, brain fog, sinus congestion, dry, flaky skin, and high cholesterol. So she was on medication for that as well. So first thing we did is an evaluation with some comprehensive testing. And part of that is a stool test that she did at home. And that came back with a parasite called Blastocystis hominis, which is this microscopic, it's a protozoan slash amoeba. So you can't see it. And it is very common. It's often a lot of our patients that I see with this have picked it up. They traveled to the islands. This particular patient had been to the Bahamas quite a bit and other islands. South and Central America is very common, and even in Europe. So we outlined a specific protocol. So, and that includes a few different things. Well, first of all, there is medication that they use to treat this. A lot of doctors think that it's not a big deal and you don't need to treat it. And then others do treat it with specific medications. The thing is, the medications, in my experience, aren't all that effective. I had blastocystis some years ago. It was about over 12 years ago I had it. And I had suffered with it for over 10 years, trying all different natural products. Also went to an MD and got different prescriptions to try and get rid of it, and the prescriptions didn't work, which they often don't. And one of the reasons why it can be so stubborn is parasites thrive off of, they love sugar, carbs, starches, yeast. So you're trying to get rid of it. And if you're still eating the typical diet, which has a lot of sugar and starches in it, it's really hard to get rid of. So one of the things I found out was the specific diet that is so important in helping to clear this up. I call it the free diet because it's free of not only gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So it's free of all those foods most commonly responsible for inflammation and chronic digestive issues. So that's one where you help to starve off the blasto. And yeast is a big part of this. And like she also had, as did I, yeast overgrowth that came back on her stool test, as well as bacterial overgrowth. So it's parasites, bacteria, and yeast, all three. And all three of those, you want to starve them by, like I said, eliminating those foods, and alcohol is included in that. So diet is one, and then supplements is part two of this. So I use a protocol of supplements, which I'll put a link below. I call it the Blasto Pack. It's a combination of 5 different supplements, which includes a specific probiotic, product called Microbalance. Yeast Defeat is another one, and acetylcysteine, and then vitamin C with bioflavonoids. That's a 3-month protocol. And then beyond that, we do what I call the functional 5. So multi-fish oil, magnesium, probiotic, vitamin D, because many people are deficient in a lot of different nutrients if you have a parasite, as was this patient. She was deficient in multiple nutrients when we got that test back. She also had leaky gut, gluten sensitivity, other food sensitivities, because again, this parasite can really wreak havoc on your gut and lead to other issues. So these other supplements we use, again, to restore proper nutritional balance and correct any deficiencies. And then at 4 weeks, we did a follow-up blood test because her inflammatory markers were high. So at 4 weeks, her inflammation went down by a factor of 5. So you want it at 1 or less, or CRP, and she was at 5. It went down to 1 in 4 weeks. She dropped 8 pounds in 4 weeks. Her symptoms, her digestive symptoms were clearing up. She talked to her doctor, got off her IBS and cholesterol medication because she wanted to give this 100%. And it turns out her cholesterol and all that improved, and our IBS symptoms cleared up, like I said. And at the 3-month point is when we do the follow-up stool test following this 12-week protocol, and her blastocystis was gone, her yeast was gone, her bacteria had cleared up in her gut. So I was thrilled about that because, well, having lived through the misery of having blasto, and I knew what it was like to finally get rid of it. So I was thrilled that not only all of her digestive symptoms cleared up, her bloating was gone, her other symptoms had cleared up too, the fatigue and the brain fog, sinuses, and all of that. So it just shows you no matter how long you've had an issue, the body has an amazing ability to heal itself. You just have to find the underlying root cause and then be provided with the proper solutions for you to heal. So what I'll do is I'll leave a link below for a copy of the FreeDiet Phase 1 food chart, so you can take a look at that. And I'll put a link to the supplements below if you want to just take a look at them, see what is involved, and it also outlines the dosages and protocol for that as well. So thanks for joining me today. Feel free to like and subscribe to my channel, and I look forward to seeing you next time. Take care.